Hello, hello, hello. Grandma Prepper here. I'm here to show you yet another one of my kits. This is a physical therapy bag. Now, mind you, typically I do not personally use a lot of this stuff, like the measurements. Generally, I will help a client take their measurements just simply for their knowledge. It's not something that we do within my job purview. And these 4 items I don't use either. They come in the kit all the time, every time. Um, and the things that I ordered separately to go in here, the tools that I typically use, have not arrived yet. So, the gate belt, definitely I use all the time, and the tapes I use all the time. And occasionally I have to use this if my clients have hit their head or something. But more often than not, um, it's generally just taking their blood pressure, helping them with their range of motion. And of course, it always comes with this little CPR kit. Um, when it comes to physical therapy, we are really restricted in the home care setting for my job description. Like I said, range of motion is pretty much the only thing that we can do, and that's helping them with their exercises and making sure that they do those exercises with the right body posture, and like turning their hand a certain way, the way that they're supposed to be turning it, or lifting their knee as high as they're supposed to be. So we cannot put any pressure. So we can help them to the point where we get resistance, but we can't push past their resistance. So anyway, just a fun little kit. I use it all the time at work. But I am waiting for the other bits and pieces to come in. Like I said, my other bag, when I was unzipping it, the whole side of the bag ripped out, and pretty much everything that could break did break. And some things were not in packages that hit the ground that we're not allowed to use if they hit the ground. So I just went ahead and put all that stuff in my kits upstairs. And I had personally paid for all of it, so it didn't matter whether it went upstairs or, in my car for work. A lot of things are provided by the physical therapists that come to the home. They give us a lot of supplies to work with our clients, and a lot of times they will give us extra supplies if we ask for them, for using with other clients that are in the same program, or just to keep in our own bags. And I have a physical therapist that will go through my bag and fill up my bag with everything she feels like I need. And a lot of it I don't even use, but there's times when the physical therapist will arrive at the home and do the physical therapy and realize that they are out of something in their own bag because they restocked. They just didn't restock enough for that day. So they'll, get into my bag and use what they need. And that's what my bag is there for the most part, is just a backup for their supplies. And if a shift ever happens, then I have what's needed. Thanks for watching. Have a wonderful day.